Hi, I'm Erin with Body Light Studio, and in our last lesson, we talked about back body expansion through the awareness of the first vertebra, right about here, and then our floating ribs. Today, we're going to talk about the lumbothoracic fascia and the muscles that come off of that. So here, it's one of my favorite anatomy books. And it's really old, it's really beautiful. You can see this diamond, it's been peeled away here, but there's this diamond of fascia, lumbo for lumbar spine, thoracic for thoracic spine, lumbothoracic fascia. And the lats, which is this big muscle, longest back muscle, go up and out of the lumbothoracic fascia. The glutes go down and out. All right, you can see the directionality in the muscles here. Let's take a look at it in Anatomy of Movement. So here's this book, and you can see your glutes arising from the sacrum and the bottom portion of that lumbothoracic fascia going down and out to the femur. And another image of the glutes, they call it pelvic deltoid muscle here. This is the glute max going down and out of the lumbothoracic fascia. And then let's take a look at our lats. One more picture here. Let's see if I can find it. There we go. Lats going up and out from the lumbothoracic fascia. So that would just be the right lat. Okay, and then on the skeleton, here's the front of the skeleton, here's the back of the skeleton. You would have the lumbothoracic fascia here, and the lats go up and out. It's like your tree branches, and the glutes, they go down and out from the pelvis to the femur. Okay? All right, so for our practice today, we're going to need probably like a blanket or a pillow, and I've got 2 blocks and a yoga strap. So we'll start on a mat against the wall. So I'm sitting up against a wall, or a door rather. I don't have a lot of wall space in my apartment. And you need to have something underneath you that's not gonna let you slip. So a yoga mat, I've got a nice carpet here, but you want your tailbone all the way back. So you're in the middle of your sitting bones. So if you're sitting back on your sitting bones and your spine is flexed, you'll need to elevate your pelvis. You can sit on your blocks or a blanket or a pillow until you're able to sit in the middle of your sitting bones with a nice long spine. And then you'll reach your arms out in front of you. Have your feet a little wider than your pelvis. You'll reach your arms out in front of you, stack your hands, and you'll start to roll down and reach your arms forward. Now, as you do this, it's not about how far forward you can reach. It's about reaching your back into the wall as you roll down. And you'll take an inhale, feel your back ribs expand. That lumbothoracic fascia widens as the ribs expand, and we're also lengthening it from top to bottom as you reach forward. And then you'll stack your spine, feeling each vertebra lift off of the vertebra underneath it as you stack up to sit. And then we'll switch which arm is on top. Take an inhale, and on your exhale, push the feet down, grow the spine taller, nod your chin to your chest, and each vertebra is going to move back before it goes up and then rolls forward into the flexed spine. Keep your arms up so they're parallel to the ground, and your lats, you're lifting your lats, reaching your lats up off of your lumbothoracic fascia. Your spine, the lumbar spine, the bottom of the thoracic spine is pressing back into the wall as you reach your lats forward out through your arms. And then you'll grow taller and taller and taller as you stack your arms. And then we're gonna twist to the right. I like to interlace my fingers. You can kind of figure out which one works best for you. Let's start with our right hand on top. I've got my hands interlaced here. We're gonna do this twice each side. We'll switch the next time we do it so you can figure out which one works best for you. Same thing, except now you're compressing the right side of your spine and you're lengthening the left side of your spine as you roll down. So with your left hand on the bottom, you're going to reach your left hand into your right hand and kind of give a little tug back with your right hand into your left. So you're giving yourself some traction here. Stay heavy in your left sitting bone. So even though you are twisting and stretching the left side of your spine, you're still evenly weighted in both of your sitting bones. You're reaching your left arm, your left lat off of the lumbothoracic fascia, and then roll up to sit. Inhale, rest your arms down, feel your head grow taller as you exhale. And then we'll go the other way. Your right hand will be on the bottom, left fingers interlaced on top of the right, and you're gonna reach your right arm out into your left as you pull your left hand back. Weight evenly in both sitting bones. Take an inhale, and on your exhale, you start to roll down. The left side of the spine is shortening, and you're reaching your right back, the right side of your vertebra, back into the wall as you roll down, twisting to the left, a little side bend, a little fold, a little twist. Keeping the arms up parallel to the ground if you can. It's a lot of work in the shoulders. Your right arm is reaching out into your left fingers as the left fingers pull back on the right hand. Inhale, the right side of the lumbothoracic fascia back into the wall and wide across the right side of the body. And then on your next exhale, press the feet gently down, stack the spine, and untwist. Rest your arms. Shoulders are getting tired. All right, keeping your right hand on the bottom, we're gonna do one more time to the right. Inhale and exhale to roll down. Now your right arm is pushing forward and your left arm is pulling back. And you're just gonna figure out which one works best for you. Maybe you like a combination of both. You can switch the stacking of the hands if the other one was better. So the left side of the vertebra are moving back towards the wall before they lift up and roll forward. Nice wide inhales across that lumbothoracic fascia. Gently pressing the feet down, keeping the knees open. And stack yourself up to sit. And then we'll switch sides. Right hand on top. Your left hand is pushing forward. The right hand is pulling back. Glide the shoulder blades down. Inhale and exhale to roll down. Deep breath into the right lung. With your breath, you can literally stretch your body from the inside out. The lungs expand, the ribs spread, they stretch the muscles surrounding the rib cage. Shoulders relax down, keep the arms up. And on your exhale, stack your spine, face forward, and rest your arms. Let's do one more time, center. I'm gonna separate my arms, my shoulders are getting tired. You might decide you'd like to push or pull. You're gonna take an inhale, and then exhale, grow taller, moving your spine back into the wall before you roll down. Feet are pushing down and forward to move the spine back. Even though I'm reaching from my lats out through my arms, I'm still suctioning the upper arm bones into their sockets. So shoulders are dropped and wide, neck is long, lats are lengthening, and then you exhale, stack yourself up to sit. All right, let's go back to the center of the space and do a little more twisting. So for our next posture, we're going to take Upavishta Konasana. So you'll spread your legs wide open. You want to be in the middle of your sitting bones. So again, if when you're in this posture, you're back on your sitting bones, you need to elevate your pelvis. You can take your blanket or your pillow or your blocks and place them underneath your pelvis. So the legs are open wide. Your feet are active, but they're not fully flexed. We want all sides of the ankle to be evenly long. The center of your knees and your second and third toes are pointing straight up to the ceiling. So notice as you start to go a little deeper into the pose, you might start to roll the feet forward. We're gonna keep checking in with the feet. And you're gonna take your thighs and internally rotate them and take your glutes back and wide. And then you'll do that on the other side, glute back and wide. And you have blocks or maybe something else handy. You can put your hands on your blocks, or you might not need them. You can have your hands on the floor. You'll start to roll your pelvis forward over the tops of your femurs and move into a deeper stretch for your adductors, your inner thigh muscles. You're strongly pressing your thighs down. So you're trying to take all the negative space out from underneath your legs. Your heels you're on the center of your heels. Knees, toes pointing straight up to the ceiling. And we're gonna be here for about 2 minutes. And you might start out only able to sit upright, and that's fine. But as you're here for a little while longer, you may be able to move your hands a little farther forward. Now, if you're flexing the spine and rounding and your shoulders are hiking up towards your ears, you need to back off a little bit so you can find the length of the lats moving up and out off of the lumbothoracic fascia, and your glutes are going down. So your greater trochanters, those outer hip bones at the top of the femurs, are rolling down. You're rolling forward on your sitting bones, but you're connected, glutes down and out into the legs, into the ground, lats up and out so that the spine stays lifted. And then find nice soft throat, wide across that first lumbar vertebra. If you joined us for the last lesson, maybe you remember to find that width across the first vertebra. And you're breathing full, long inhales, spreading the rib cage wide open. And on your exhale, the ribs soften down and in. Your ribs, they open out and up as you inhale, kind of like bucket handles, lifting and widening. And as you exhale, the lungs deflate, and the ribs, kind of like when the wind is taken out of the sails, they just soften down and settle in. Maybe about 10 more breaths here. You might be pretty far forward on your sitting bones by now. Keep pressing your legs down. Active in the feet, you can spread the toes, but you're centered on your heels. Knees and toes pointing straight up to the ceiling. My right knee always likes to roll in. I've got to really get that glute to go down on the right side. And then if you're pretty far forward, I'm not here yet. Actually, I could probably do it if I used more than one block. You could put your head on blocks. Sometimes it's nice to put a block right at the pubic bone and then drape your body forward. I actually like that. I feel like I can get a little deeper, but still maintain my long spine when I have that resistance at the pubic symphysis. Another 2 or 3 breaths here. And then you'll bring your hands back, lengthen the spine up, and then grab a hold of your belt, and you're gonna lasso, or loop it around your right foot, and then just set that down for now. And you're gonna lift up, and from your hip sockets, start to turn your pelvis. So you're not turning, you're turning your pelvis to the right, but you're not turning your left femur. The left femur stays glued to the ground. From your pelvis, the left hip socket turns forward, the right hip socket turns back, and then we're going to reach with our left hand for the right foot. Now, if I allowed my spine to round, the front of my spine is shortening, the back of my spine is lengthening, I can reach my foot, but that's not what we're going for here. We want to find length up through the front of that lumbothoracic fascia and the back. Pressing down through your left sitting bone, the left glute is going down. And you're gonna inhale your right lat up and off of the left glute. So we're finding a cross-body connection through those back oblique lines. Left glute going down, right lat going up off of the lumbothoracic fascia. And then you've got your right hand on the ground for support, or maybe you can reach your foot with both hands. We'll be here for another minute or so. Inhale deeply into your left lung. And exhale out of the left lung. Maybe you can turn a little bit more, rolling the spine to the right, angling the heart over the right knee, pressing the thighs down. Let's inhale into the right lung, grow a little longer up through the right side. And exhale out of the left lung and twist. Reground your left glute. Inhale up through the right side body, and then exhale, twist. Maybe you can reach a little bit more for the foot. You can start to let your head release down. Press your thighs down. Let's do 2 more breaths here. Inhale, right lung. Exhale, turn the heart, turn the spine. 1 more breath like that. Right lung, inhaling. And exhale to twist. And I'm just going to let my head go for the last moment here. Stretch the back of the neck and roll myself up to sit. Keep your twist over the right leg until your spine is stacked, and then you untwist and you face forward. Let's do the other side. So I'll take my strap, loop it over the left foot, leave it there. And pressing down through both thighs, especially grounding through the right femur, the right glute, you start to twist from your right hip socket rolling forward. You're twisting to your left. And then you'll lift the spine. Your right leg is growing longer out of the pelvis as you turn over your left leg and fold. Pressing the thighs down, grounding the right sitting bone. Inhale, lift up through the front of the lumbothoracic fascia. Exhale, turn the spine. Pelvis turns, sacrum turns, lumbar spine turns to the left. You can grab a hold of your strap or maybe your foot, or keep the hands on the ground. Sometimes it's nice to have a block to support your hands here. Inhale, left lung. Exhale out of the right lung. Maybe you fold a little bit deeper. Pressing down through the thighs, just check in on those right toes and knee. Make sure that the knee and toes are pointing straight up to the ceiling. Inhale, left lung. Exhale out of the right lung and turn. Where in your spine are you shortening? Where are you long? I'm going to lengthen up through the entire spine. Your right glute is rooting down. Left lat lengthening opposition of the right glute. So you've got that cross body, back body length. Another 2 or 3 more breaths here. You may allow your head to release down. If you've got a hold of your foot and you have the range, you can bend the right elbow and widen it out to the right. Shoulders going down the back, pressing your thighs down. Let's take another inhale into the right lung, lengthen the right side body, and then exhale, twist and fold. Keep your twist as you stack your spine. Once you're nice and tall in your spine, you'll untwist and face forward. All right, let's take off your strap, grab a hold of your knees from the inside, and swing your legs together. Give your knees a hug. You can rest your head on your knees. All right, let's go to the wall again. All right, so I've got my yoga mat long ways back up against the wall. Heels are actually up against the frame of the closet here. And you're pressing your heels down and out. And you'll feel your hips cinch in as you do that. You want to take your adductors, your inner thigh muscles, and press them out. Press the heels down and out. And then we've got our 2 blocks. And you'll bring your hands down onto your blocks, hands right underneath your shoulders. Your sitting bones are going back into the wall. The pubic bone is going back through your legs towards the wall. Your heart, your sternum is going forward, and then you'll walk your hands forward and let your head release down. Now I'm pushing with my hands down and forward, which is taking the lats up away from, actually down out of the lumbothoracic fascia. And I'm pressing my sitting bones back into the wall, so my glutes are going back off of the lumbothoracic fascia. So the lats are reaching forward, the glutes are reaching back, we're lengthening, and then we're using our breath, our inhale, to widen the lumbothoracic fascia. Triceps are rotating down to the ground, head is released. Keep your jaw relaxed and your tongue resting at the roof of your mouth. Keep pressing the heels down and wide. And then you'll walk your hands over to the right. So we're going to stretch the left side. You can have your right hand on the ground or on your block. Most important is that this left arm stays long. Head is released, so there's no tension in the back of the neck. You're reaching your left sitting bone back, the center of your left thigh back into the wall. So your glutes going back and down, and your lats going forward and up off of the fascia. As if you could breathe in through your left armpit, you're inhaling, expanding your left lung. Keep reaching that left sitting bone back. You're shortening the right side of the spine, and you're lengthening the left side of the spine. You can bow your ribs to the left. Feeling your left ribs widen and press out into the muscles, into the skin, stretching the left side body. And then you'll bring your hands back through center and over to the other side. Left hand can stay on the block or maybe onto the ground. Right arm is long. Try to keep your pelvis even. Notice if you're hiking one hip higher than the other. Your inner thighs are pressing out. The feet are pressing down and wide. Right tricep rotating down to the ground, and head is released. Press your right sitting bone back. Take that right glute back and down into the heel. And then your right lat forward and up, lengthening the whole right side of the body. Shoulders on the back, so the back of the neck can release. Deep inhale through the nose, tongue is resting at the roof of the mouth. Pressing the center of the thighs back into the wall, especially the right thigh back. Take one more nice inhale here. And long exhale. And then you'll bring your hands back underneath your shoulders. Lengthen pubic bone back, heart forward. Let's put the left hand directly underneath your sternum, right hand on your hip, and you'll twist to the right. And as you do this, likely that your left hip is going to want to drop and your right hip is going to lift up. You're going to press your left adductor, inner thigh muscle out into the bone, left heel down as you turn the heart. And then grow the right lat up off of the fascia. From the front of the lumbothoracic fascia and the back, you lengthen, crown of the head forward, press your thighs back. Maybe you reach your right arm up. Head reaching straight forward, sitting bones pressing back into the wall. Inhale to untwist. And we'll bring the right hand underneath the sternum. Left hand onto your hip. Press your right heel down and out. Press the right inner thigh, adductor muscles out into the bone, and twist to the left. And then maybe you can feel in your sacrum, are you hiking your left hip up? Do you need to press your right inner thigh wider? You want the spine to lengthen straight forward away from the wall, so you're not on an angle here in your twist. You're going straight forward out of your tail as if your spine were a spit. Maybe you gaze up to the ceiling. Maybe you lift your left arm up. Just notice when you lift your arm, it's likely that your right hip will want to drop, so you feel like you're getting more twist. You want to keep your pelvis level and turn from the spine. Earlier in our seated forward fold, we were twisting the pelvis. In these standing positions, we're going to keep the pelvis level. Take an inhale and exhale, twist, growing that left sitting bone back. And then inhale, untwist. And once again, both arms stretch forward. Feel the width across your back, the fullness of your breath. And bring your hands underneath your shoulders, heel toe your feet in a little bit closer. Bend your knees, hands onto your hips. Squeeze your elbows together, stand up, feeling the weight from your pelvis, your glutes, go down into your feet. And you can step your feet together. Inhale, sweep the arms up so the glutes are going down and out from the sacrum, the top of the pelvis, into the outer hips. And the lats are going up and off of the lumbothoracic fascia, up and out through your fingertips. Lift the front of the body up. Take an inhale and rest your hands down by your sides. Close your eyes and feel the awareness of your back body. Sense the 360 degrees around you. Maybe you can even feel what's going on in the room behind you, the walls behind you. And bring your hands to prayer. Press the palms to connect the shoulders on the back, to widen the clavicles, and open your eyes. Thank you for joining me today. See you soon.